Hey, this is Rick Downs from Sleep Balance Academy, and I'm going to show you the deck that we use for community seminars and also Gang of Five seminars. In this deck, you will see things that you can remove or replace whenever you want to. I want you to download this slide deck and then use it as you see fit. There are parts in here that should not be shown on the community seminar because there's some slides here that are meant just for you. So let's go ahead and do a presentation here. Here's the slideshow. And I'm going to go ahead and cut that down. So we're going to talk about snoring, the treatment lead generation income center for medical and dental practices. It's a quick start program. Since we're in the SDR program, we're not into extensive treatment, but I will show you some of the treatments that is available to all of us, dentists and chiropractors. Snoring, it's not just a noise. And this is a presentation that has the collaborative input from Online Home Sleep Study, Dental Sleep Balance, Dental Chiropractic Collaborative, Primal Air, and Dr. Joseph Selk and Body Metrics. So let's go and just talk a little bit first about the epigenetics of deficient face development. And epigenetics is anything that works upon your body to limit or change the expression of genes in your body. And a lot of that has to do with our facial development. So the epigenetics of a modern lifestyle include lots of allergies, sinus infections, viruses, a soft diet, and then also these lack of breastfeeding, the sugars that we're putting into our diets, allergies, the retained adenoids and tonsils, inappropriate tooth loss or removal by dentist, large tongues, our genetic makeup, weight gain, and poor posture. These things can all affect how our face develops and our airway and whether it's open or not. Disordered airway signs and symptoms in children could include snoring, mouth breathing, extended upward face while asleep, attention deficit hyperactivity disorder, bedwetting, thumb sucking, bruxism, which is grinding of teeth, sweating while sleeping, night terrors, frequent earaches, allergies, poor school performance and aggressiveness, crowded teeth and small jaws, tongue tethers, speech impediments, and weight gain. And all this is what we're seeing as pretty much is worse all the time with children. And you can see this even on television. This is a Lysol commercial that you see on TV, and you'll see this little kid sleeping. And then most people don't even realize that this is an abnormal posture. He's got his head tilted up, his mouth is open. This is not a healthy child. Neither is this child. It might look cute to some people. Even Lysol executives who put this ad together didn't realize that they're showing something that is completely abnormal. And with this abnormal, we can see the airways collapsing in the back and the tongue moving to close off this airway because of the lower jaw moving backwards. As a matter of fact, when the upper jaw narrows, becomes narrow from left to right, then the lower jaw has to go posterior in order to accommodate the bite. And that is something that is a big problem in our society. And then a tongue tether doesn't allow the tongue to go to the roof of the mouth. And that inability for the tongue to go to the roof of the mouth means that the upper palate will not widen like it's supposed to. And that upper palate widening is extremely important if we want our lower jaw to come forward. So I'm going to show you a video of my great nephew, okay? And this is the little boy who is sleeping right in this particular disorder when he's sleeping. And I want you to see this because it's pretty revealing. And parents are seeing this and not doing anything about it. And you can hear the child is snoring. Just stops breathing. Now his breathing is opened up. He's come out of deep sleep to order to gain some breath. So he's losing deep sleep categories every time he's aroused, but he doesn't know it because he hasn't woken up. Notice the lower chin is slightly retruded and he's breathing through his mouth. Notice the nose is also upturned slightly. Okay. Let's go back to the presentation. So dentists use a lot of things to help with this, with the deficiencies that happen with our mouths in order to widen the arches. We can use orthodontic appliances like this. Sometimes we use tongue trainers. A lot of the chiropractors are now using this to stimulate the tongue. It's a tensing unit that's specifically made to change the muscle fibers in your tongue and help strengthen them. It changes the fibers in the muscles of your tongue from fast twitch to slow twitch. That would be the opposite you'd want in a muscle for a sprinter, but in the tongue, you want slow twitch fibers. Then you have MSE, which is mid-sagittal expansion, and we can drive in 4 little implants into the palate, and then a screw in between, and then we widen that arch. We split the suture open in the palate, and you can see the opening in the front here. That's how much gain of space that this has been achieved by this. Then when you get to the point where you want it, you just put in a retainer, you remove the little implants. And this not only widens the oral mouth airway, but also the nasal mouth airway is also opened up because the floor of the mouth is the nose. So let's go backwards in. Snoring is not just a cosmetic or annoying problem. Snoring in and of itself can cause damage, including axion swelling, cell damage in the soft palate and the throat, and plaque accumulation in the carotid arteries. Snoring causes a number of maladies like heart enlargement and bronchitis. Snoring causes sleep loss for you and your partner. It harms their health as well. Snoring worsens with time. Snoring is a sign you need a sleep study. So here's a patient that's one of my patients that I was treating. You can see that this person is a heavy snorer. And what happens after that, after a while, is the uvula elongates. It gets longer and longer. It should be a short height uvula. So those are things that you can see when you see the damage that snoring is causing. And the axons and the muscles up here are all being atrophied. So screening is the first step we do with our patients, and is what we're teaching our SDR members to do. Modifying screening questionnaire and with the Epworth score and the Circle Plus ring is an FDA cleared high sensitivity pulse oximeter with no racial bias. This is the only ring on the market I know of that will do accurate readings on all skin colors. It also measures oximetry every second. Whereas like something like a wristwatch with Apple will do it like once every 15 minutes. Here's a reading from the circle ring on a certain patient. Matter of fact, this is a celebrity that we were treating out in Portland. And this celebrity, as you can see, has extremely high heart rate throughout the night. Even the average is abnormal. And the ODI is abnormal, but not appreciably. That's still in the mild category. That's the oxygen desaturation index. You can see the average oxygenation is not too bad, but the lowest minimum is a little bit too low. And then you can see that this T90 score, which means any scores under 90% saturation, You want to see those all be 0. So, and also down here, you'll notice in the bottom of this particular person that there is no REM sleep whatsoever. See, completely lack of REM sleep would appear green on this particular bar, and this patient is seeing no REM sleep whatsoever because they're constantly being aroused out of REM sleep by these micro obstructions that are taking place. No REM sleep, heart rate, abnormal ODI, and we use this to monitor our patients. This is essential to our monitoring program, and one of the things that we want all of our patients to have. No matter what treatment we use, we can determine how well it's working with this ring. The data of the Circle Plus ring will give you an ODI every second. As I said before, it's no racial bias. It'll also give you temperature, sleep latency, sleep stages, the T90 score, and the heart rate, and much, much more. Screening is the first step, and we use the modified screening questionnaire with Epworth score. And I've shown that to you before, but I'll show it to you now. This is the screening form that we want to all patients to fill out so that we can determine when they go through this score whether they need a sleep study or not. If it turns out that they're in a very low category of risk, then we won't order a sleep study. We also want to do the Epworth score, which is a sleepiness scale that a lot of insurance companies want. The Epworth scale is a standard screening for daytime sleepiness. After we do a screening, if we determine that they need a sleep study, then we will order a sleep specialist telemedicine call with our patient, and we will also get a sleep test done. And the sleep test will take the form of 2 devices that we use in our program. We have a sleep specialist in all 50 states, so we can do this. And by the way, Eric, you can stop and talk to me if you have questions anywhere along the line here.
Okay.
Okay. Monitoring is crucial. That's why we have the Circle ring, and that's also why we have the in-hand health portal. We have to monitor these patients, and we want to make sure that their health is maintained. So we use the in-hand health portal to upload all of our data that we're monitoring the patient about, whether it might be the sleep or our exercise program or some sort of therapy that you might be administering to the patient, like weight loss. By the way, those people who are doing ChiroThin would have a really handy help that would dovetail really well with the sleep apnea program. Because weight loss is another crucial component of controlling sleep apnea. And there's the monitors for in-hand health. We monitor both sleep and the autonomic nervous system, which is a very big importance to chiropractors. I know it is for us too. And then this is some of the things that you see on the app. Then we're going to have in-office snore products that we're going to be dispensing to patients. The night balance sleep position or wedge. This will keep people on their side so that they actually breathe better. Most people breathe better on their lying on their side. Not everybody does, but most people breathe better sleeping on their side. And specifically, they'd be better off on their left side. If you want to help prevent GERD during the night, stomach acid tends to go less likely to go into your esophagus if you're laying on your left than on your right. But either way, sleeping on one side or the other is good for you. We have a balance. We have a sleep positioner that actually vibrates. It sits around the chest and prompts the patient when they sleep on their back to turn on their side. We also have the XyloGuard nasal sprays, the H-Guard nasal spray, the Snore Guards, the lip seals, nasal strips and cones, the Bongo RX and nasal aid, and we'll show you those in a minute, and custom lab-made appliances that we can have dentists do, and actually we can have our chiros do that as well. One of the ways you examine the nasal valve collapse is have the patient turn their head backwards and have them suck into their nose real quick with air. If it collapses like this, then you know you have a nasal valve problem. And many people need a nasal dilator when they're sleeping because this does happen. These muscles are also atrophied. There's a dilator muscle around here. And oftentimes in modern people, that thing won't, you can see people that you see sometimes that their nasals will actually dilate. That's a healthy nose. You can do what is called a caudal procedure here to see if a patient would be better. And I'll teach you what a caudal procedure is some other time.
Yeah.
Here's one of the nasal aids that we sell. We recommend this one because the nasal aid here, it doesn't touch the nasal septum. It only hits on the outside of the nasal valve right here. And then it comes and arches over the nose. Now, for most people, that stays in just fine. But for those where it falls out easily, just put a piece of tape over the outside here to stay in. But this is going to help people a lot. Just a nasal breathing at night is going to help control snoring and open the airway by at least 21%. Peer-reviewed article on dilators, and this is the one I was just telling you about. This PubMed article you can look at later. But before the application of the mean value of the subjects, it was 6.68 liters per second. And with the device in, it was 0.84 for a 21% improvement. They also help snoring for some because nasal breathing often produces less snoring than mouth breathing. Mouth breathing causes snoring because when you open your mouth, the jaw falls backward into the throat and the tongue goes with it and cuts off the airway. You want nasal breathing while sleeping. We're also going to be supplying you with nasal rinses called the Xylogard is the first one. This is a xylitol type rinse that we ask people to use. 20% of people who use xylitol nasal rinses also had improvement in breathing and lowered snoring. So you've got the nasal dilators and now also these nasal rinses. And you can read about that at clear.com, but we'll also have some references on usaguard.com, which is where we're going to be getting our rinses. We have a dual rinsing system. We have the Xylogard, which is the xylitol rinse, and then we have the H-Guard, which is the hypochlorous acid rinse. Hypochlorous acid is also a natural product. Our white cells make hypochlorous acid, and this is what our white cells use to kill bacteria, fungi, and viruses within our body. Our body naturally makes this, and we have it now in pure form, and we're going to be putting it in our rinse for the nasal at a 100 parts per million or 110. It helps shrink the turbinates and open up the airways even more. It kills microbes, it's anti-inflammatory, and it helps release nitric oxide from the sinuses. Nitric oxide from the sinuses, your sinuses produce nitric oxide all the time without the use of bacteria to do so. And that nitric oxide being released from the sinuses goes into your lung and helps control blood pressure. So we're going to be helping people with blood pressure with just these simple devices. More about H-Guard. In the Spanish study, I don't have the reference listed here, but they used hypochlorous acid breathing through the nose and saline rinses with hypochlorous acid, and it reduced the symptomologies. The risk of disease progression was also reduced for COVID-19 patients. Its administration was well tolerated. There were no important adverse effects. The treatment effect was mediated by a reduction of inflammation and apparently increased antiviral immune response induced by the active species of oxygen and chlorine. Hypochlorous acid is a free radical, which is used by your body to kill viruses. Here's some different kinds of snore guards. Some of these, for instance, like this one here, Snorehook, is a kit that you can get and you can make easily in your office. We can teach you how to do that. There's also some that you can buy online. I don't recommend them because they're not easy to use. This one here is easy to use. I recommend it highly. It's an FDA approved. This is FDA approved, and so is this FDA approved for treatment of snoring and actually sleep apnea. So is this one. Okay. Then there's lip seal products and tapes and chin guards. I believe that they're great for assisting you in mouth and not mouth breathing while you're sleeping. But you don't want to do this if you don't have an open nasal breathing. And many people are doing this, and I think they're making a mistake. If they can't breathe through their nose, they should not be using these devices. That's why you need to get the dilators and the sprays in their nose. Then you can think about if you're getting good nasal breathing, go ahead and seal the lips. By the way, this is easy to open and close. You can open with this on, and then it'll seal right back up once you put your lips together. So then the next thing you do after screening is a home sleep test, an HST. The profit margin for dentists and beginning sleep medicine practices are possible by starting with snoring. It is possible to get a substantial amount of the marketing budget for sleep patients from this. Ultimately, you want to get patients to agree to a formal sleep study. We will introduce you to the system for that. Here's two of them that we were recommended through the SDR program. The Night Owl, which is a one-finger home sleep test. It's FDA approved. And the Sleep Image, which is also a home sleep test that's FDA approved. That Night Owl is a mini, and it actually can do 12 nights of study with $165 purchase for that device. So you're paying about $16 to $17 per study. Okay. The Sleep Image Ring, they're a subscription service. They make you spend $100 a month at minimum. I think it might be more than that now. So you can get 5 studies a month, and they're about $20 per each one. This one's the only one we have that can do children. The other one, this is adults. This is children and adults. So Online Home Sleep Study is a site that I have for people that want to order their own sleep study as a patient. A patient can go there, order their own sleep study. They don't need the authorization from a physician or from their insurance company. They don't need any authorization at all to order their own sleep study. And we have that for people because some dentists live in states where the dentist cannot order sleep study by law. There's 7 of them. And so I just tell those dentists to go ahead and send the patient here to order their own sleep study. Okay. If you do that, though, you can't add any profit to that because of the Stark laws. Okay.
Yeah.
OnlineHomeSleepStudy.com. This is a website for tests generally good and mostly used by professionals and is insurance based, but can be done by cash only. None of them support those going through training like we do at SBA. We train you better than anyone else. Here's some more mouth guards. This is called an EMA. This is called a Herbst, another Herbst, and a Herbst. Okay, that's what that little bar there calls it, a Herbst. These are PDAC appliances. In other words, they're approved by Medicare. So then chiropractic adjustments for oral appliance TMJ cases. Every time you send a patient to a chiropractor, you want them to come back to you immediately because when those appliances go into the patient's mouth, it stretches their jaw forward. They're going to get muscle masseter pain, temporalis pain, and TMJ pain. We would like the chiropractors to see that patient right away so the patient gets used to their appliance because if they don't wear it, it's not going to work. Here's some more alternative treatments for sleep apnea that we use in Sleep Balance Academy. As I showed you before, the Excite-OSA tongue trainer. We have the INAP, which is a negative pressure therapy that you put this in the mouth, it seals the lips automatically, and then the suction pulls the tongue forward and the palate forward. The tongue goes to the roof of the mouth, the palate comes forward and opens up the airway. People like this a lot better than the CPAP. Works really well too. And then this is that side sleep trainer I told you about before. Slips around the waist. You put this in here, it vibrates and teaches the patient to sleep on their side.
Now, Doc, you've been using the INAP, right?
I've been using it. I got one myself, yes.
Okay, and how does it feel? Like when you're trying to sleep?
I like it a lot better than my oral sleep appliance. I like it better. Okay. I like it better. As a matter of fact, it's the most comfortable appliance in the mouth I've ever tried. Okay. It's better than CPAP. It's better than the oral sleep appliance that I have, and I'm a dentist. So I'm telling you, this thing is working better. I've used it, and when I got it, it has a 40 millimeters of water pressure, which is too low. So when you put people on this, you need to get them to go up to a higher pressure, close to 100 right away. Otherwise, it's going to fall out of the mouth and they're going to be frustrated and want to return it. You've got to get that pressure up right away. In here is a saliva collector, a little piece of a little envelope with a gel in it. and you change that gel every day because you don't want saliva getting into the machine. And
Right.
then you have to replace these about every three months to get a new package of or 3 packages of 30. Bongo RX is another type of therapy that we can treat, and definitely chiropractors can do. These cones fit in the nose. They not only dilate the nose, but they have a one-way valve. And when you breathe in, there's no resistance. But when you breathe out, there is resistance. And what that does is it acts like a CPAP. That resistance on breathing out inflates the throat and all the airway down into the lungs like a balloon, and it opens the airway up. It's called expiratory uh, 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 papillary pressure. Okay,
Okay.
expiratory pressure. And then there's myofunctional therapy. Many of you can do myofunction therapy. You might even have some in your offices, but we also can do it by telemedicine through our work with Primal Air and Shirley Gutkowski. She will treat your patients telemed and be able to treat myofunctionally what they need to have done. And there's definitely improved airway with myofunctional therapy.
Yeah.
Weight loss. This is, I told you people with chirothin would be a perfect fit for this. Weight loss will improve sleep apnea, but for most, it will not solve the issue. Used in combination with other therapy, it is very, very useful, though. As a matter of fact, it's overlooked and a very important part of this process. Now, this is a slide that you don't want to include in your presentations, but I'm including it for you guys just to see some of the places where our income is available through the different online stuff that you do. I think this is way off because, like Dr. Shane Smith is having everybody come in on $1,000 purchase, and he's just giving away the ring and the nasal dilators and getting them on the in-hand health right away. By the way, when they come in, they must go on in-hand health right away, and you need to get them up to speed with the app in your office. Somebody's going to need to do that for both the Circle Ring and the in-hand health portal. So we can go through a quiz here, but what percentage of those who snore have obstructive sleep apnea? The answer is 80%. What is the first step in implementing sleep care in your office? Sell a mouth guard, get them a home sleep study, fill out a screening form. Well, of course, it's number C.
C.
Sleep physician training can solve snoring for what percentage of those? For what percentage of those who snore? Actually, it's 70%. Snoring, not necessarily sleep apnea, but it can solve snoring for up to 70% of people that just sleep on their side.
Wow.
Clear, which is that nasal rinse I told you about. We're going to substitute guard in there as a prescription nasal rinse. It's false.
False.
Snoring can in and of itself cause health issues, and that's
True.
Right. Women. Now, this is kind of like a whole new presentation here. We're going to go into women and snoring. Okay. In this study, Women in Health magazine, they found that that cardiac changes in self-reported snorers suggest that earlier heart treatment and heart impairment in women could point to undiagnosed sleep apnea. So what they found was that snoring in women was actually more detrimental to their health than it was for men. Okay, pretty important. And the new just came out this year. Obstructive sleep apnea now recognized as a cause of heart attacks. It's actually now known to cause heart attacks. Okay, very, very sobering news. So I told you about snoring and what it does to the damaging of the of the axon. It has axon damage. This is the study that shows that, and you can go to the references here. But the axon degeneration was in pre-terminal nerves of the soft palate is associated with pharyngeal dysfunction in snorers and patients with sleep apnea. The most likely cause of the nerve injuries is traumatic snoring vibrations and tissue stretch, leading to swallowing dysfunction. By the way, That swallowing dysfunction can be helped by that Excito-SA tongue trainer.
Mhm.
As you get older, you see a lot of swallowing dysfunction. I've noticed in myself. I choke more easily as I get older. This is a good thing. And I've told the company they need to start petitioning the FDA for treatment of swallowing dysfunction as well. Okay. So there's an increased risk of upper airway obstruction here. And so the Schwann cell damage is a real thing. They also saw that snoring was associated with chronic bronchitis and lung fibrosis. In this article, you will see the evidence for that. The conclusion was that snoring is associated with chronic bronchitis. Our findings provide support for the hypothesis that snoring influences the development of chronic bronchitis. But they also said later on in this article that they didn't know why that was happening. And I can tell you what I think is going on. They thought maybe the vibration was causing inflammation in the lungs. That's possible. But I think when you're snoring and your mouth is open, you're actually sucking bacteria from your nasopharynx and your tongue into your lungs. You're breathing in aspirated bacteria, and that's what's causing the fibrosis. Expiratory snoring. Now, some people snore when they exhale rather than inhale. And so expiratory snoring actually predicts obstructive pulmonary disease in patients with sleep disordered breathing. And what they're saying is that expiratory snoring is actually more serious than inspiratory. The soft pellet, good news is though, the soft pellet can heal. Brain-derived neurotropic factor is upregulated in the soft palate muscles of snorers and sleep apnea patients. That's important to know. Damage can be healed. The soft pellet can heal. The conclusion was that brain-derived neurofactor is upregulated in the airway and swallowing dysfunction. But upregulation of this is suggested to be a response to denervation and reinnervation and repair of injured muscle fibers. Our findings propose that the damage of the upper airway muscles might heal following treatment of snoring and sleep apnea. So even if you treat the snoring, you're going to have some healing take place in these axions. 80% of those who snore have obstructive sleep apnea. Answer to your test. You owe it to yourself and your loved ones to get tested for OSA. Why we want to do telehealth and home sleep testing? Because of privacy, lowering cost. It lowers healthcare costs also. It lowers cost to the patient, but it lowers healthcare costs in general. Fewer car accidents and trucking accidents. Undiagnosed and unrecognized sleep apnea is a big problem, and we can find them if we start talking to people who snore. And concern for their sleep partner's rest and health is also extremely important. Why would you do this? That's because there's a lot of good reasons. Your health and your loved one's health. And to lower your cost, frankly, because people are being treated for heart disease and lung disease and having strokes and surgeries on their heart when they could be getting at the source of the problem. Why not do a non-invasive, non-drug therapy? That's what we're teaching here. Non-invasive, non-drug therapy. And really, that's what chiropractic is all about, I think. One of the things they're about. Okay, so am I at the end? Looks like I am. So that's it, Eric.
Cool.
Did you like it?
I did. I can do this, no problem.
I think you can too. And what I would hope to do then is that, let me just close this down. That slide deck, you have actually access to it. If you go to your the welcome letter that I sent you guys.
Mhm.
All right, you go in here. Here's the welcome letter. And I put this in the website, but you'll see in here, if you go down to item number slide deck, that right there,
Yeah.
that will take you right to what we just had. Okay. And all you have to do is download that slide deck and put your, label your practice on it, put your name in it, do whatever you want with it. And that's for you. And I think it would be great for Gang of Five presentations and for you to talk to your patient base about this. Okay.
Okay.
Oh, cool, huh?
Yeah. No, yeah. Actually, I've think about the idea of doing some talks at some of the local libraries
Yeah,
about snoring.
this is gonna be, one of the, now you can add to it, because you're gonna find your own information and material, but why not? Get something to start at least, okay?
Exactly.
Yeah, and I want you to make sure that all of you go through this punch list, do every one of these things. Because this will help you get started. There's a lot of things in here, for instance, in this document center, where you can find all the documents that I think will be of use to you. The documents include, not that, but there's a head and neck physical exam form if you want to visit. There's better sleep forms, the two of those. One's to get yourself a sleep study authorized by the physician. The other one is the screening form I just showed you. And then down here, there's the American Dental Sleep consent form. This is a consent form for treatment. I think you should have a consent form or tailor that to yourself. And then here's another one that's called a referral, your refusals. So if a patient wants to refuse treatment, have them sign a refusal form, okay? If they have an intolerance to their CPAP, have them fill this out and sign it that they're intolerant to the CPAP and they want to use an INAP, use this form. This will help them get insurance benefits, okay?
Okay.
All these forms are here for you guys to use. Okay, good.
Okay.
All right, cool, huh?
That is cool.
All right. Any other questions?
No, not at this time, actually.